We have a very large Endocrinology Institute. Our role is to try to provide the best optimal care to patients. Our approach to diabetes is through what we call a adipocentric approach. We care about improving the hemoglobin A1C, addressing any potential complications because of the diabetes, but our main effort is addressing the weight. With a very integrated approach, we have endocrinologists, we have obesity specialists, nutritionists, psychologists, exercise physiologists, social workers, working under the same roof to proportionate and to facilitate great care, not only today, but long term.
Here at Cleveland Clinic, we understand obesity as a very complex disease, so you must have a multidisciplinary approach to be able to effectively help patients with this disease. So we work as a team to be able to approach the patient as a whole. We are using some innovative approaches for treatment of obesity. From the exercise perspective, we have a smart gym that help patients to decide what is the best exercise for them, and we monitor over time. As the patient progresses, the exercise will change over time. This instantly feeds information to make those changes and also to optimize research across the enterprise.
Two of our largest clinical research projects in the recent past has been Empower T2D as well as Transition T2D, which are two trials in patients with type 2 diabetes that are really trying to focus on the patient's weight. And so focusing the management on changing therapy to help facilitate weight loss as well as improving glycemic control is really the aim of both of those studies, and really has shown to have a tremendous impact on patients' glycemic control, but also their weight loss progress.
Clinical research is really a top priority in the Institute. It is highly encouraged and supported by the leadership. There are plenty of opportunities to get involved at different levels, and really Cleveland Clinic is an outstanding place to do research. We have a large amount and variety of patients all across the enterprise, and the Institute has all the infrastructure and the human resource necessary to conduct research. As for education in patients with diabetes, I think the mainstay in diabetes management is education. And the Institute has an amazing group of diabetes care and education specialists from different backgrounds who provide education in diabetes both in a one-to-one fashion or in the context of group classes and shared medical appointments. And they do really a terrific job with the patients.
So bench research at the Cleveland Clinic has a wide range. What really excites me, I think, it's the possibility of looking at several aspects related to metabolism and cardiovascular issues in our patients with diabetes and how to prevent complications in these patients. Over the many years, the research has focused on risk factors for metabolic disease, cardiovascular disease, and renal disease in these patients. And now we are learning that we can also focus on factors that can prevent these conditions or perhaps even reverse some of these complications.
So the inpatient telemedicine endocrinology program is a service that's provided to hospitals that previously we haven't had individuals seeing patients at. So we do asynchronous and synchronous telehealth visits. In the asynchronous visits, we provide a service where we do a chart review, give recommendations, and let the provider know at that location what we recommend. The synchronous is when the patient is seen in person or by video, and then they're able to talk, and then we give recommendations that way. We've been able to, with this telehealth medicine, close this equity gap by seeing patients that we weren't seeing before, be it in the hospital because we don't have someone there, or other ways where patients don't have transportation or that availability as they did before.
Here at Cleveland Clinic Endocrinology, we have taken steps to identify patients who would qualify and benefit from continuous glucose monitoring. We have also increased the education of endocrinologists themselves in our group such that they are more comfortable in offering CGM to their patients, because as more patients get to know about the availability of these technologies, we in the healthcare sector have to adapt to this and make that care a little bit more convenient for our patients with diabetes.
So we've seen coverage really expand, and earlier this year, Medicare expanded their coverage now to cover anyone who's using insulin. Also, the coverage even includes people that have hypoglycemia, such as those on maybe a sulfonylurea. And we see other plans often follow what Medicare is doing. So that means that really opens the floodgates now. So many people are eligible now to get a CGM. And so I think we owe it to our patients to make sure that they have access to this amazing technology.
Our institute is very interested in providing care across lifespan. Unfortunately, many of the diseases that endocrinology takes care of are chronic conditions that will require chronic treatment. So that's very important. For us, it's also extremely important to create an environment that our colleagues feel comfortable to work in, that they are in agreement with the vision and what we're trying to accomplish, so they can grow professionally, they can play a role in the community and make a difference with their patients and also having a good quality of life.